Hi there, welcome to our series on diabetes. Now, today we'll be looking at type 2 diabetes. Okay, in the last episode, we were able to digest type 1 diabetes and we were able to provide some of the things that we did not do in our previous series, right? Now, type 2 diabetes. You know that we have over 400 million people who are living with type 2 diabetes all over the world. Now, this number is staggering. Now, what is the problem? The problem of type 2 diabetes is that the sugar which you take, the body does not have enough insulin, or the body is resistant to the insulin that works on that sugar to get to the cells. Now, when the body does not have enough insulin, it means that the body is underperforming when it comes to sugar metabolism. Now, some sugar will be accumulated in the blood and that will lead to elevated blood sugar level for a prolonged period of time. Okay, and so what is the symptoms? The symptoms remain some of the things we said in the last episode. Okay, the 3 P's: polyuria, polydipsia, and polyphagia. Polyuria is consistent urination. Polydipsia is consistent drinking of water, and polyphagia is excessive eating. Okay, now these are the basic symptoms, okay, which the doctor uses to diagnose, okay, diabetes. Now, but beyond that, we also have other symptoms. A lack of energy. The person is feeling so tired and even fatigued. The person is exhausted. Okay, you have blurry vision. Okay, you have pain and tingling of the hands and the feet, especially at night for people who have it. Symptoms becomes more severe and graduates into complications if nothing is done. So that is why the earlier you're diagnosed, the better for you. Okay, so it is best to go to the hospital and let the doctor see you as soon as possible. So what are the causes of diabetes? There are 2 major causes of diabetes. It is that insulin is not produced enough, okay? And this could be as a result of lifestyle, okay? Probably or sedentary lifestyle. The person is not exercising, the person is gaining weight, and this weight is affecting the production of the pancreas, okay? Or it could also be genetic. There are people who this thing run in their family history, in their bloodline. So this could be that the body is not producing enough, or the body is resistant to it. They are the major causes, and this can be as a result of genetics. It runs in people's bloodline, or lifestyle. People are not eating healthy, and this results to sedentary lifestyle. Okay, it affects them. They are not able to exercise, okay, because they've gathered a lot of weight and so they feel tired every single time. But the truth is, whenever you're not able to exercise, that is when you need to exercise. That is a secret that most people need to know. Whenever you feel tired, you always feel tired not to exercise, that is actually when you need to start exercising. So what are the diagnoses of diabetes type 2? Okay, type 2 diabetes can be diagnosed in 2 forms basically, but there's a third one which I will also add. The glycated hemoglobin 1 HbA1c, HbA1c, okay? And then the fasting blood sugar level. Then there's another one, oral glucose tolerance test. Is a form of test that you give the person sugar, and after an hour you give the person another sugar, and then observe how it's digested or how it's metabolized by the body and test your result. What are the risk factors in type 2 diabetes? We have a lot of risk factors. We have genetic predisposition. Okay, there are people who genetically it runs in their family. Okay, they have either the problem of insulin production or the problem of being resistant to insulin. Is like a generational problem. Another one is genetic with respect to obesity. There are people who genetically they are already predisposed to obesity. Okay, so this set of people, if they are not properly handled, they will eventually be diabetic. Okay, so they are the people that are at risk. Okay, next people are people 45 years and above. You remember when we discussed it earlier, I mentioned to you that type 2 diabetes happens to people who are a little bit advanced in their adulthood, right? Even though there are exceptions, like I said, there are people who have early onset of type 2 diabetes and they also go through, these things, okay? So from 45 years and above, you need to be careful because diabetes might be calling if you don't live a healthy lifestyle. The next set of people are if you're black. Black people are one of the races in the world that are predisposed to having type 2 diabetes. It's there on record. You are black, you are Hispanic, you are Indian American, sedentary lifestyle. If you're living a sedentary lifestyle, you have a greater chance of being diabetic, like I said earlier. An unhealthy lifestyle too, you also have a greater, chances. Sedentary lifestyle means that you're not exercising, you're always lying down, you're always doing things just, on your own. You're not physically active, you're always, not being active. Okay, so unhealthy eating is also another thing, right? You're not eating healthy, your food is high in carbohydrates, high in fat, everything is high. So every single time you're frying, you're doing all forms of fries, all of your foods, your chicken is fried, your fish is fried, your egg is fried, everything is fried. You have a problem. Okay, the next thing is somebody who had gestational diabetes. If you had gestational diabetes and you also had microsomic baby, gestational diabetes is diabetes during pregnancy. We'll discuss that in another video. Now, some people have gestational diabetes and it eventually leads to having microsomic baby. Microsomic baby means that your baby is too fat. Okay, now it means that your baby is anything from 4 kg and above at birth. Okay, now if you have this condition, you have a greater chance of being type 2 diabetic much later in life. Okay, that's why you need to prevent it at all costs. The next people are people that have polycystic syndrome for women. Okay, polycystic syndrome, and people that have it, they are at risk of having diabetes, and it's something that every lady needs to watch out for. Okay, what are the treatments? How do you treat type 2 diabetes? First of all, you need to see your doctor, and when you see your doctor, you need to be very, very serious. You need to be very determined. The determination will lead you to be serious with your drugs, whether it be your drugs or insulin that you're given. You need to take them seriously. don't for any reason miss taking them. Now, I'm not saying that you will take it for all through your life, right? Now, leave that for now. Don't be concentrated on what will happen in the future. What we want to achieve is the now. Keep your sugar low now. Take your medication. Now, the next thing you will need to do is take your diet very seriously. Your diet needs to be serious. You can eat every other thing. Don't be deceived by people who tell you eat this particular thing, eat that particular thing. All those advice. Forget about them. Go see a dietitian. You can come to us. We will help you, plan a menu that will include all the staple food that we have, okay, in the right proportion for you, made for you, okay? So don't be perturbed about you will only be eating beans and all that. You won't eat all those things that you want to. The truth is, if you have a good dietitian, you will know what works for you. That's the best thing that you can ever do. Get a dietitian that knows what works for you. Don't just get anybody out there and then do whatever you hear. Get the dietitian to help you out. Okay? So the next thing is you don't need to start doing things anyhow. Okay? Don't eat anyhow. You need to eat at regular intervals. These are things that the dietitian also will handle. Control your weight and then get about 30 minutes of physical activity every day. Okay, for the rest of the week you have at least 150 minutes of physical activity. Okay, these are ways you can help yourself to be healthy. Okay, what are the complications of type 2 diabetes? We have diabetes retinopathy, that is your retina is affected. Okay, the nerve that takes blood into the eyes, okay, is affected because the blood is no longer, the cells are no longer getting the required energy to help out. So over time it starts affecting your eye. Diabetes retinopathy is a condition where the neurons, okay, they are affected. When I said the symptoms, we have a tingling of feet and the hands. It is about the neurons. The neurons are not getting, the sugar that they need to function properly. So over a period of time, you will discover that the neurons are affected. They are not working again. So it's as if they are starved and they are starved to death. So it gets to a point where you start feeling numbness. You don't feel a part of you, even if there's a pin or a nail that feel it again. Okay, it's a very dangerous situation. That's why people with diabetes type 2 diabetes are usually advised to wear things on their leg, because sometimes you no longer feel that sensation, okay, that skin sensation. You can injure yourself, and then there is also wound healing, which is a symptom of diabetes type 2. So you have difficulty in wound healing. That's why you need to avoid every form of wound. Diabetes nephropathy is the kidney. It affects the kidney, that it destroys the kidney and leads to the kidney failing. Okay, if not taken care of, it leads to the failure of the kidney over a period of time. We also have skin problem, of course. It increases the level of infection. Okay, it could be bacterial or fungal infection. That's why people with diabetes will usually have ulcer problem, because it happens, down the leg. Okay, foot ulcer. You can, be infected by fungi or a bacteria, and then that wound will go on and get to a point where it will start damaging your leg, because the wound is refusing to heal. And when it gets to that point where gangrene is formed, and at the end of the day the doctor says your legs need to be cut, that's it. So it's because of the bacteria or fungi infection, and you must avoid that at all costs. Cardiovascular disease like hypertension, okay, narrowing of the arteries, okay, maybe high cholesterol, angina, which is a pain in the chest, okay, heart attack. Okay, this is why anybody with diabetes need to be very careful, because the cardiovascular system is also affected. Once your kidney is affected, the next, system, cardiovascular system. Okay, so you need to be careful. Okay, it's very important that you don't take it for granted. Take your medication seriously and take every other thing serious. And then the final one, which is the one, erectile dysfunction. Yes, men have it as complications. This is one of the symptoms that graduates into a complication, because if you allow it to linger for a longer period, it means that this problem can be permanent. Okay, so you don't need to leave it as a complication, because you don't stand a chance during complication, or you stand a chance, but the chance they are asleep. Okay, so make sure everything is still under control before you start your treatment. That's why you need to prevent complications from coming. So keep it as low as possible, and then you will be able to live as long as you want. Conclusion: type 2 diabetes is not a death sentence. Now, I understand that many people dread this particular condition, and I understand, because it has destroyed a lot of people. But at the same time, I want to tell you something. Type 2 diabetes is absolutely controllable. You can control it and still live as long as you want to live. As long as you're able to adopt a treatment plan with your doctor and your dietitian, be open to new knowledge, be open to learning, okay? Because diabetic education is very important. If you must survive this whole diabetes, you need to open your mind to learn, okay? So learning is very key, and that is what we do in our 30-day diabetes secret code program, okay, where we help you understand this condition and then hold you by the hand, make you accountable, so that you follow a system that will help you arrive in a successful place with your health, okay, where you're not complicated, you are not unhealthy, you are not suffering from one other complication or the other. So the idea behind it is for us to work together, okay? Let us help you, let us educate you. I am a diabetic educator by profession. I'm a registered dietitian by profession. So I can help you with your diet, I can help you with your knowledge, I can develop your knowledge on this particular topic. Now, if you want to contact me, go to the description. You will see a contact, okay? You can contact me through WhatsApp, contact me through Facebook, okay? You can connect with me personally, and then there will also be a link to our website, okay? If you've not subscribed to this channel, I'd like you to go now, click on that subscribe button, click on the notification bell, so that you'll be able to know when we release our subsequent video, okay? If you have not watched the other episode on this series, okay, go to the description. The link to every one of the videos on this diabetes series is there. I can assure you, you will learn a whole lot, okay? So click on the link, subscribe to our channel, like this video, share it, and I tell you, you will be better for it, okay? I remain your dietitian, Fechi, and I'll see you